There are some people who believe that getting HIV is a result of promiscuity that deserves to be punished. In January 2004, Catherine Lopuka faced the wrath of her relatives for getting infected with a virus that has claimed the lives of scores of people for over 3 decades. She faced a barrage of questions from her own family members in a setting that was quite like a courtroom.
I went to the village where my parents were living. I carried all my food, but they migrated from the village. They left me with my children.
Word about her infection had already spread, so the villagers began avoiding her.
Sometimes I went to the borehole to fetch water. People, they could just run in the borehole. They leave us alone.
Catherine's troubles only got worse.
The worst one experience in life. My sisters hiding my treatment, and they were telling me, "What are you? You are taking these drugs for what? You are going to die."
According to the 2011 Uganda Demographics and Health Survey that looked into people staying in regions willing to take care of AIDS patients, Karamoja scored worse at 52 for women and 62 for men. As the years went by, Catherine's frustrations and miseries only got worse. Her husband was bedridden and her son experienced the negative attitude that his relatives had towards him.
His brother came and said that he's going to die. He went to those places that saying that my brother's died. You bring money so that I can survive. That so that I can bury him properly with me. He went and got money, everything he took in the house. Like that, when he came back, the house was just empty.
So I entered inside the house. I removed the clothes. I came with the lasso. And then I told them, before you take these things, first take this thing from me, because this is the only property that man loved.
As all this went on, Catherine's husband was struggling to stay alive.
It pained me a lot, because if I was to die, I don't know where my children could be.
The locals in Karamoja live in a communal lifestyle, but Catherine's friends shunned her.
When you go there, they call you, "Catherine, come, have this brew." For me, I think that we shall share from the same jug. Yes. So this time they could buy for me only.
Her ordeal was also experienced by 50-year-old Michael Olay. In 2011, the news of his HIV positive status was broken to him. The stigma wasn't fine coming.
The stigma caught me properly. Even people feared. They could not move near me. They could not eat with me together. Even sleeping, I sleep at the door when they're sleeping in their beds.
His wife too left with their 3 children.
Until 2012 November is when she came to check my life. If you have gone away, but she got, I'm still living.
Counseling sessions plus medication coupled with free meals from the World Food Program helped revitalize him. But it was short-lived.
Every time you hear your heart bumping, said this is the time now. I'm ready to go. Hey, crying tears. Everybody comes in the room and peeps you like this, then runs away. Said he's almost dying. You don't reach there.
Michael and Catherine say Karamoja still has a long way to go in overcoming stigma.
Every time they mama slowly when they see you.
A 2013 report titled The People Living with HIV Stigma Index by the National Forum of People Living with HIV Networks in Uganda, NAFOPAN, with UNAIDS, indicated that most people living with HIV are worried about being gossiped about.
Stems from the fact that someone thinks because some other person knows the status, then the person is talking about that.
It is really making us very, 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 very uncomfortable. Stigma is too much in our place here.
The myth about HIV won't stop in the Karamoja region.
When you greet somebody who loves you very much, he gets the handkerchief and he started cleaning his hands and goes and wash his hands. Cleaning out the HIV? Yeah, that you will get HIV already.
Even if rain comes, when the things are outside, nobody can pick it because I'm HIV positive.
Now nobody ever engages in an argument with Michael.
When I move near them like this, they run away. They said, if he catches us, he will bite us and he gives us HIV.
The UNAIDS country coordinator, Musa Bungudu, says that such attitudes should stop if the world is to achieve the 3 zeros, ending new infections, stopping deaths and discrimination.
80% of women and 69% of men, they have one level or another way of discriminating against people living with HIV.
But in as much as there is external stigma, internal stigma as well is high, and the impacts registered in Uganda's first ever stigma index are daunting. Not having more children, not getting married, living in isolation, and some desert clinics. The Uganda AIDS Commission, with UN partner support, is putting in place an action plan for stigma reduction in the country. 2015 is the determinate year of ending it.
The very people who took my things, they are now staying with me.
My wife has come back now. She's even in the house already.
They are a happy lot. Catherine's husband is healthy and working, and their children are HIV negative. Florence Naluyimba, NTV in Moroto, Karamoja.